Good morning. My name is Alex Nazaroff. I'm an attorney at Weinberg, Roger, and Rosenfeld, representing SCIU Local 521, the union representing workers at Kern Medical. Yesterday, we filed a complaint with the Fair Political Practices Commission against 3 current and former chief executives at Kern County Health Authority. The 3 executives named are former CEO Russell Judd, its current CEO Alton Scott Digerson, and its CFO Andrew Contu. The complaint alleges numerous conflict of interest violations by these executives, including that they funneled millions of dollars away from the public hospital to their own management companies and influenced the Board of Governors to retroactively approve these overpayments during board meetings as routine consent agenda items without the need for any discussion by the board. Now I'm going to turn it over to my associate Winnie Bien for some context.
Hi everyone, my name is Winnie Bien. I'm an associate at Weinberg, Roger, and Rosenfeld, representing SCIU Local 521. To provide a bit of context, the FPPC is a nonpartisan commission that focuses on transparency in government and ensuring that public officials function in a fair and unbiased manner. A big part of the role of the FPPC is to investigate potential conflict of interest violations by public officials. We hope that the FPPC will carefully investigate the allegations made in our complaint and hold these public hospital executives accountable for any violations that they find. Next, I'll introduce Sydney, who filed the complaint yesterday.
Hello. Thank you, Alex and Winnie. My name is Sydney Galusha. I'm a strategic researcher for the Workers Union at Kern Medical, SCIU 521. With the guidance of our legal team, I filed a complaint under my name with the FPPC. My job in our union is to research facts, public records, and data trends so Kern medical workers can build a stronger union and form arguments to stand up for what's fair in the workplace.
You got it, Sydney.
I've conducted a thorough investigation into publicly available records. My research suggests that the named parties influenced the hospital's governing board by controlling what is placed on public agendas, rolling back the governing body's oversight and authority abilities, and failing to investigate credible allegations of overpayments for executive services. Filing a complaint with the FPPC was the only approach to get answers for taxpayers, Kern medical workers, and vulnerable patients who depend on Kern Medical for affordable health care. I've worked closely with public servants who work as public hospital workers. They speak up and advocate for themselves and their patients daily. I've received countless calls from Kern medical workers being short-staffed, overworked, and sacrificing their breaks. Anything they needed to do to tend to their patients and give them the best possible care. KCHA's public agendas and minutes on their website suggest that there was no proper board oversight over decisions to overpay the 2 private firms that ran the hospital, Meridian Healthcare Partners and Cantu Management Group. When we approached the Board of Governors to look into credible allegations of $23 million in potential overpayments, they refused to start an investigation and repeatedly rejected our request to meet and discuss the items that are detailed in our complaint. Today we will release a micro website of primary source materials and a timeline. On the micro website, we will disclose the points in time where oversight and authority were rolled back. As for examples, this includes when the board retroactively authorized the CEO, CFO, and others to open and close bank accounts. In September 2016, when they delegated the authority to the CEO to exempt certain Kern medical officers from completing conflict of interest disclosures, and in September 2017, when the board dropped the requirement that the CEO provide quarterly written reports of expenditures paid under a resolution designating him as the purchasing agent. the way the safety net hospital is running is something that would be abnormal and alarming in the private sector. My opinion is that this should not be how we run a public hospital. Close to 8% of Kern County residents do not have health insurance, and approximately 45% rely on Medi-Cal. Both patients rely on affordable healthcare services provided at Kern Medical. Safety net hospital managers should be loyal to the taxpayer and vulnerable patients, and it appears they failed to do so in Kern County. That is why I'm encouraging the FPPC to accept our complaint and move forward with an investigation into our claims. Next, I'd like to introduce a Kern Medical Clinical Lead Nurse in the Emergency Department, Anna.
Yana.
Good morning. My name is Anna Palacio. I'm a clinical nurse leader in the emergency department and an SEIU 521 member and union shop steward. I've been serving and caring for members of this community as a registered nurse at Kern Medical for over 12 years. I love my job and I love working with neighbors and many of your friends and loved ones who have relied on the care that Kern Medical has provided. I am here representing hundreds of staff members providing care to a medically underserved population within a safety net hospital in the only trauma and academic teaching facility in the county. For far too long, we've been asked to do more for our patients with less from our management. But yet we continue to show up day after day because we know we are the only option for our patients to receive the care they need and deserve. As a union shop steward, not only do we speak up on behalf of our patients, but we also speak up on behalf of ourselves. In fact, between September 2022 and June 2023, union members, the majority of whom are nurses, filed 782 assignment despite objection complaints to Kern medical managers, union leaders, and the California Department of Public Health. These ADO forms are used by nursing staff to formally document situations in which they believe a staffing situation is inadequate or unsafe, and that management was notified that despite taking the assignment, it was against Kern medical policies, state regulations, and posed a risk to patient safety. We documented 782 complaints, and then we took care of our patients. In 2023, 3 different departments submitted anonymous written complaints and petitions with signatures to address these working conditions, which included no breaks or missed lunches, insufficient staffing, and consistently working out of ratio. Lastly, we speak up when we see a staff retention issue. In RED, we always welcome new nurses as the first job out of nursing school. We are happy to train and develop their skills, but we need experienced nurses to teach, and we don't have them. In the last few years, I've witnessed a historically high number of experienced nurses leaving, and the focus of management seems to be doing more with less staff, which has come at the expense of experienced, skilled, and expert nursing staff. Instead, the management over-relies on traveler nurses, who are temporary and significantly more expensive to hire than permanent nursing staff. As for myself, I continue to attend our labor management meetings to discuss issues like this, and I encourage our staff to continue to speak up for better working conditions and patient safety at Kern Medical. Nothing at Kern Medical will change if we stay silent. As healthcare professionals, we must continue to elevate our practice, and that means we must choose to speak up when our patients' lives depend on it. Together, we will use our voice to motivate and inspire those around us, and I look forward to working with each of you to ensure our patients to continue to have a place where they are protected and cared for.